Good morning, good afternoon, good evening. I am Dr. Quigieng, and today we will talk about a cause of blindness that you must know. You are alive, you have your two eyes, but it is possible that you become blind secondary to a particular disease, and that disease is called glaucoma. I'm sure you've heard about that term before, glaucoma. I had this patient, a 43-year-old female, Mrs. Janet. She was a baker, and she came to consult because progressively over a 3 month period of time, she noticed that her vision was decreasing. She was not seeing as well as before, and it was a painless process. Initially, she saw that in her periphery, she was not able to see. She was seeing more centrally, and as time passed, her visual field was reducing, and she decided to consult. We did some tests of visual field, we did some ocular tests that we call fundoscopy, and she was sent to the ophthalmologist. And the conclusion of her problem was that she had glaucoma. What is glaucoma? Glaucoma is a disease of the eye. It's a disease of the eye that manifests as a result of increased pressure within the eye that damages the optic nerve and eventually leads to blindness. When we talk of the eye, I want you to think of an orange. An orange is a kind of spherical fruit. If you cut it into three parts, we'll consider the first one third as the anterior part and the second to third as the posterior part. So it's the same way. Your eye is an oval structure that is made up of two compartments, an anterior compartment and a posterior compartment. The anterior will represent the one third and the posterior will represent the two third. And within the eyeball, there is fluid. And depending on which compartment we are talking about, we will call it aqueous humor or vitreous humor. When you have glaucoma, the same orange that we were trying to simulate, imagine that this is a syringe that is about 50 mils, and you inject it into the orange and you push the 50 mil into the orange. You will notice the volume of the orange to increase. It's going to swirl and maybe crack up, and if you push another one, the pressure inside the orange will become so high that it may burst up. So it's the same thing in glaucoma. The fluid within the eye tends to increase, the volume of the fluid tends to increase because there is a blockage in its natural drainage channel. And because the fluid increases, the pressure increases, and eventually there is pressure and damage on the optic nerve, and it is the optic nerve that permits us to see. So that is the basis of glaucoma. What happens that there is a problem with drainage? As of today, we cannot really explain, but we know that there are some risk factors. The black race is one. If you are black, if you're a female, and if you have a family history of glaucoma, that is a parent or an uncle that has glaucoma, there is a high chance that you too will develop glaucoma. How does it present? We have talked about what it is, we have mentioned who is at risk. How does it present? Here we have two scenarios. We have a progressive onset, which was the case of Mrs. Janet, where progressively you lose your sight, initially in the peripheral field, progressing to the central field, and eventually blindness, no vision at all. This is usually what we call open angle glaucoma, because within the eye, we talked about the eye, but within the eye there are structures. There is the lens, there is the iris, and there is the cornea. So between the lens and the iris, there is usually a sort of angle. If that angle is open, we term it open angle glaucoma, and here the symptoms progress with time. It is not sudden, it is not abrupt. On the other side, we have a more rapid onset, we have a brutal onset where we call close angle glaucoma. The loss of sight is usually abrupt, and it is associated with redness of the eye, with pain, with headache, with nausea and vomiting. So there are two modes of presentation: rapid onset, slow onset. The commonest one is the slow onset. How to know that you have glaucoma? Usually It may be symptomless initially, but you have an increase in the pressure in the eye. But if you notice a change in your visual field, in your ability to see, it's an indication for you to consult. Also, systematic visits, regular checkups, annual checkups from a certain age of 35. When you go to the hospital, ask to do a fundoscopy. It's a routine eye test, but it can give an idea of how the pressure in your eye is. Just checking, we can look at your optic disc to find out how the nerve is doing and to have an idea if you need further testing, which will eventually lead to the diagnosis of glaucoma. If you have a family history of glaucoma, if you as an individual you have glaucoma, you need to sensitize your children. Encourage them to do routine checkup from a certain age because it can be picked up earlier and the progression of the symptom can be slowed. What to do when you have glaucoma? What options do you have? As of today, there is no clear treatment for glaucoma. We do not cure it, but we halt the progression of the symptoms. We can stop them through some interventions, and the interventions may be medical or surgical. It depends on your particular case. You discuss with your doctor, he runs some tests, and he decides on what is going to happen. Are there some preventive steps? Yes. Regular checkup, regular visits to the eye doctor, or systematic visits if you are used to the concept. Glaucoma is the second leading cause of blindness in adults worldwide. So any person that was initially seen and that later became blind in life, probably the cause is glaucoma. And it does not affect only adults, it can also affect children in a scenario that we call juvenile glaucoma. And a famous person who suffered from this disease is Ray Charles, the famous blind musician. He suffered of juvenile glaucoma. That is why he became blind around the age of 7 or 8 years. Glaucoma, second leading cause of blindness in adults. Regular checkups is the best step for prevention. If you have a family history, go for checkups. Thank you for your kind attention. It was glaucoma. See you another time for another medical education.